Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Okay, Minister, thank you for speaking with us today. Could we begin with our vaccination numbers?
Well, as of yesterday, we've had 230,486 persons who would have received their first dose vaccine. This would account for 47.3% of our adult population. And as of yesterday, we've had 104,605 persons who would have received their second dose of the vaccine. This accounts for 21.5% of our adult population. So I think we are making steady progress in terms of getting people their second dose.
All right, thank you so much, sir. I wanted to take you a little bit away from COVID and ask you about Rehab Week. Now, we know that many of these departments have been able to still offer service even during the pandemic. Could we talk a little bit about Rehab Week and basically what it means and so on?
Well, Rehab Week is an annual feature within the ministry where we celebrate the work that is being done by our rehabilitation staff. In this pandemic, apart from the regular work that they have been doing with patients, stroke patients and others who would require rehabilitation exercises and so forth, they have played a very important role for COVID-19 patients, because you would recognize that a lot of COVID-19 patients would have challenges with breathing, and before they leave the institution, our rehab workers would normally take them through a number of exercises so that they can have good lung function. So they've been very instrumental in doing that, and I think because of the kind of work that they've been doing, many of the patients who leave the hospital would have benefited from the staff of the rehab department working with them.
I wanted to, back again to COVID, wanted to ask you a little bit about the Delta variant. We read that it now accounts for about 10% of COVID-19 cases in the US. And particularly, we wanted to ask you if we should have any particular concern about that in Ghana.
Well, as you know, the virus has been evolving. So from the original strain that came from Wuhan, we would have seen several mutations with this virus. In late 2020, we were talking about a variant that was first discovered in the UK that is now referred to as the Alpha variant. We now have a Beta variant that has also been circulating, and a Gamma variant. The latest one that is of major concern has been Delta, and this was first seen in India. And a couple of weeks ago, you would have noticed that this particular strain of the virus would have caused a lot of people getting infected, people getting hospitalized. In some cases, hospitals could not cope with the amount of persons who required hospitalization, and there were lots of persons who died because they were not able to get the kind of care. This particular variant, because of its transmissibility, would have also spread to a number of countries. So as you said, in the US, as of the 15th of June, they estimate that you have about 15% of the variants that are circulating is from the Delta variant. We have also seen this variant now in the UK. We have seen the variant in Indonesia. We have seen this variant in different countries of the EU. In Portugal, it has caused a resurgence of infections there. And we have seen that it has now caused a spike in cases in Russia. So these variants are going to circulate, and this particular one is now on the upswing, where it's it's now circulating in several countries around the world. And it is causing an increase in cases, and it is causing more hospitalization and possibly more deaths. Now, this particular variant has 9 mutations on the spike protein, and because of where these mutations have occurred, this particular variant is more transmissible. So it is twice more transmissible than the alpha variant, which was the one that was in the UK, and you know that one was really highly transmissible. So this one is even more transmissible. So that's one of the hallmark. So if people get it, it is going to be passed on very quickly. In terms of severity, again, this one is very severe. And what they have noted is that people who are unvaccinated would be the persons who would be getting infected with this variant more often. So unvaccinated persons are going to be at higher risk for getting infection with this particular variant. There's also that possibility that this variant, there is that possibility that even if you had an infection before, that you can get reinfected with this particular variant. So that's something that is now being studied more closely. And in terms of whether or not our current PCR tests would be able to detect it, so far the test kits that we have would be able to detect this particular variant.
Okay.
There are also some concerns that this variant, because of some of the mutations that it has, vaccines might not be as effective as they should. However, some of the studies that have been done, if you're fully vaccinated, it protects you from the more severe form of the disease that this particular variant can generate. If you are not vaccinated, well, then of course, you're putting yourself at risk. So again, in all the countries where they've seen this variant circulating, there have been a big push to get people vaccinated. So I want to make that call here as well to ensure that people are vaccinated so that we can prevent any variant for that matter from affecting our population.
Right. I'm glad you mentioned the vaccines because I wanted to ask you about that. So thank you for clearing that up, as well as the basic guidelines that we've been repeating over and over. That is still in place as another way to keep yourself safe.
Well, if you wear masks and you wear them consistently and properly, when you're in the public, then you'll be able to protect yourself from persons who might be carrying the virus. If you, however, don't wear a mask and you're in close proximity with an infected person, obviously you're putting yourself to get the infection, and therefore that's something that we have to keep reminding people that it's important to wear masks. Again, if you stay appropriate distances away from people, then you're reducing your chances of infection. And of course, we know that if you go into indoor environments where aerosols can be circulating in the air, you're also putting yourself at risk. So again, if you take these common sense precautions of wearing masks, keeping distances and so forth, then obviously you will be protecting yourself and lowering your risk for infection.
All right, and while we're on this particular subject, I just wanted to talk about, I know the checks are still in place at the airports and other ports of entry and so on to ensure that persons who come in are not infected or so. And you sort of mentioned that with the PCR being able to still pick up this variant.
Yeah, so we have, like with other countries, we have requirements for anyone traveling to Guyana. and those requirements have been in force from since last year. They haven't changed. The requirement would be that if you're coming into the country, you need a PCR test. If the PCR is within 72 hours, then when you arrive here, you don't have to go into quarantine or do another test. If it's more than 72 hours, then at the airport you'll be required to do a second test, a second PCR. And if that is negative, then you're okay. If it's positive, then you'll have to, of course, go into isolation.
All right, sir. I have a question from Kaitra News. So they're asking, they said yesterday in your update, you stated that in the last 3 months, the Ministry of Health have seen an increase in hospitalization. Can you provide some data on that? And what are the numbers of hospitalization during that period?
So, you know, on a daily basis, the amount of people in hospital would vary. But on average, we can give an average number, which would be the mean between the highest and the lowest that we've had for that month. So, on average, for January, we had approximately 18 persons per day. In February, that increased slightly to about 23 persons. Then in March, that went up to about 38. In April, that went up to 66. And in May, it's approximately 87. And in June, it remains around 87. Now, this is an average between our highest and lowest number. So it doesn't represent the true numbers that we'll have per day. So a good example of that is that today we have 73 persons in our hospitals, and we have, of those 73, we have 18 in the ICU. So again, it varies by day. So these numbers that I'm giving you is just an average.
Okay, Minister. Well, thank you so much for speaking with us. That's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.